Hello, welcome to a supportive information session provided by Addiction Services of Thames Valley in London, Ontario. Our topic for this presentation is overdose prevention. If you are interested to connect with services for you or someone else, you can call for services in Elgin County, Oxford County, Middlesex County, and London. We are open Monday to Friday, and our intake is running between 10 o'clock a.m. and 3 o'clock p.m. You can call the general phone line 519-673-3242 and follow the recorded instructions, or you can use these extensions to direct your call. For information and intake support, call extension 222. For current clients and intake support, extension 284. For family members and intake support, extension 221. For withdrawal support, extension 248. For the Rapid Access to Addiction Medicine Clinic, or the RAM Clinic, you can call extension 281. For other information and service updates, go to adstv.ca or follow us on social media so that you can get updates on how we are adapting our services during the COVID-19 crisis. For additional mental health, addiction, and crisis support, call 1-866-933-2023. You can also use the web chat at reachout247.ca. And if you are needing someone to talk to, you're feeling stressed, overwhelmed, or lonely, you can call the support line at 519-601-8055. So currently all of our counseling services at ADSTV are being offered via telephone and web-based because of the COVID-19 crisis. So on this slide, there's a few tips on how to protect your health. So I'm just going to go over that quickly before we begin our presentation. Coronavirus is a new illness that affects the lungs and airway. Practicing good hygiene is the best way to protect your health from this virus and other illnesses during cold and flu season. So firstly, washing your hands with soap and water for at least 20 seconds or using hand sanitizer. Minimizing close contact with other people. That means maintaining physical distancing, sitting or standing at least 2 meters or about 6 feet apart from other people. Stay home if you are sick. Symptoms of COVID-19 include fever, cough, and difficulty breathing. If you are staying with other people, try to keep your distance. And if you're worried that the symptoms might be coronavirus symptoms, you can do the free self-assessment on the Canada website under Public Health Services, or you can call the Middlesex London Health Unit. The number is 519-663-5317, and you can press 1 for the COVID hotline, which is monitored right now Monday to Friday from 8:30 a.m. until 4:30 p.m. So normally with our supportive information sessions, we begin with a grounding exercise. The purpose is to help calm the mind and relax the body. It helps with focus, to be open to and improve inner awareness and support making positive mental or physical changes. So for our grounding exercise today, I chose an excerpt from the book In the Realm of Hungry Ghosts, Close Encounters with Addiction by Gabor Mate. I thought this quote would be appropriate for the topic of overdose prevention, which has affected so many people because addiction and trauma affect so many people. So as I go through the words of Gabor Mate, I want you to think about how you're feeling in this moment, what brought you to the presentation today, and be mindful of how your body reacts to the normal passing thoughts that go through our head. Maybe you know someone affected by addiction, maybe you've lost someone to overdose. So just bring a conscious awareness to your body and your thoughts as I read these words. The greatest damage done by neglect, trauma, or emotional loss is not the immediate pain they inflict, but the long-term distortions they induce in the way a developing child will continue to interpret the world and her situation in it. All too often, these ill-conditioned implicit beliefs become self-fulfilling prophecies in our lives. We create meanings from our unconscious interpretations of early events, and then we forge our present experiences from the meaning we've created. Unwittingly, we write the story of our future from narratives based on the past. Mindful awareness can bring into consciousness those hidden past-based perspectives so that they no longer frame our worldview. Choice begins the moment you disidentify from the mind and its conditioned patterns, the moment you become present. Until you reach that point, you are unconscious. In present awareness, we are liberated from our past. So to begin our presentation, I'll introduce myself. My name is Christina Vanelli. I'm an addiction and mental health counselor. Most of the work I do is one-to-one counseling, occasional group counseling, and I do some outreach work at the Overdose Prevention site, which is called CarePoint, through Regional HIV/AIDS Connection in London, Ontario. The purpose of our presentation today is to provide information about how to save a life and reduce potential harm. So these are the items we're going to cover. What is overdose? Overdose facts, overdose treatment myths, factors contributing to overdose, recognizing different types of overdoses, so that includes stimulants, depressants, and hallucinogens, minimizing risk, an overdose response plan, naloxone, and overdose aftercare. So an overdose is when the body's overwhelmed by exposure to something, in this case, a toxic amount of a drug or the combination of drugs, which causes the body to be unable to maintain or monitor those essential functions necessary for life. So those functions include things like breathing, heart rate, and maintaining body temperature. An overdose can last up to 8 hours, and not everybody who experiences an overdose will die. However, there can be long-term medical impacts from overdose. So I can give you an example of that. If a person has experienced an opioid overdose and they've fallen on the floor, the tissue in their muscles that's underneath the weight of their body might be damaged as a result of being unconscious for many hours in one position. And that can have long-term effects like scarring, nerve damage, and things like that. So it's important to consider that overdose is not equivalent to death. There are other consequences that can happen. Opioid overdose has become one of the leading causes of accidental death in the province of Ontario. Ontario Public Health found that fentanyl and fentanyl analogs were the strongest contributors to overdose deaths. And between July 2017 and 2018, there were over 1,337 confirmed opioid-related deaths in Ontario. And nearly half of those individuals who died during that period were alone at the time of the incident. Other substances that were found to contribute to overdose death were cocaine, methamphetamine, alcohol, and benzodiazepines. Fatal opioid overdoses are rarely instantaneous. They usually happen over 1 to 3 hours. So this next slide looks at some of the factors that contribute to overdose risk. So first would be the substance. Is there more than one substance? Is a person mixing substances consciously or unconsciously? Sometimes the quantity of the drug is hard to measure because some drugs are harder to measure than others, and some drugs have varying time release mechanisms like immediate release or extended release. Individuals might have taken more of a drug intentionally or by accident, and sometimes people are unaware of the additive effects of combining substances. Potency, so that means the concentration, the quality, and cut. Substances can have unknown content because of the way that they're processed, or because people who have handled the drugs before the consumer may have added things to the substance to create more or to change the effects of the drug. Looking at individual characteristics, age, like the older and younger you are, might affect how your body processes a substance. It also might speak to your lower level of tolerance. So tolerance means the body's ability to tolerate or endure and metabolize a drug. Tolerance can change rapidly, even with just a few days of not using or reduced use. High risk times would include exiting jail, hospital, detox, or treatment after a period of abstinence, or if a person is starting to taper down or make changes to their methadone. A person's health status also plays a role. Their general physical health, like your liver function, kidney function, respiratory function. If somebody has a compromised immune system, high or low blood pressure, heart disease, diabetes, if they are a smoker, if they're managing a current infection, if a person's been sleep deprived, dehydrated, malnourished, as well as genetic factors can play a role. So for example, people who have indigenous or Asian heritage might metabolize alcohol differently just based on their genetic factors. Other individual factors could be things like medications and prescriptions. The liver processes all of the drugs that enter a person's body. So if a person has damaged liver or they're on medications that impact the way their liver functions, they may or may not be more prone to overdose. And looking at route of administration, the route of administration will determine how quickly a drug will take effect. So generally, a fast injection into the vein will affect the body a lot more rapidly and intensely than ingesting or eating a substance. In general, the faster the drug hits the bloodstream, the greater the risk of overdose. And people can still experience overdose from drugs even if they are not injected. When a person's tolerance is lower, the body's not as good at processing the drug. Sometimes this can happen just after a few days. So tolerance could be lowered by no use or even just reducing use over a period of time. So some of those high-risk times we talked about include periods of abstinence, detox, treatment, hospital, jail stays, if a person is a new substance user or if they are beginning to taper their use. If a person is feeling sick, tired, dehydrated, or they have general health issues that affect their liver, kidney, or respiratory functions, they are at increased risk for overdose. So that's because the body is already functioning at a slower rate, including the way a person breathes. So your body's more likely to be slower at processing the drug that enters your system. Sometimes overdose can happen because the drugs are stronger than we are used to. So if there's been a change in the drug supply or a change in where the person has acquired their substance, that can put them at risk of overdose. So it's important to know like where your drugs are coming from, if you have a good relationship with the person supplying to you, so they can inform you of any changes in the supply. And changing suppliers or changing towns can also put you at an increased risk because of changes to the drug supply. So if you are making a change in like provider or town, like you're moving, please consider that that could play a role in the drug supply. And we'll talk about some strategies about staying safe and reducing your risk later in the presentation. So these are some of the overdose treatment myths that we've encountered, and you might have seen some of these things in movies and things like that. So what are some of the ways that you have heard that other people say can reverse or treat an overdose? Sometimes these things can be maybe obvious or less obvious. We don't recommend to put a person in a bath or in cold water. There's a movie called Candy in which one of the protagonists has an opioid overdose, and to save her, they throw her in a cold tub of water. But don't do that. The person could go into shock if they're already having trouble maintaining their body temperature and breathing. Probably not a good idea to put them in a tub full of water. Also not recommended to induce vomiting because a person could choke. You also might not be able to get all of the substance out of them by inducing vomiting, so safer not to. We also don't recommend to inject a person with anything else. So there's a myth that if you give somebody like salt water or cocaine to counteract a depressant drug, or other sort of myths like injecting with milk and saline water and things like that. So don't inject anybody with anything but naloxone. It will not help, and it might actually cause more harm. We also don't recommend to slap kick people in the groin or burn them or hit them in any way, like that could be seriously harmful, and it's not going to rouse somebody who is unconscious. And lastly, don't recommend to sleep it off. If a person stops breathing, they could die, and if nobody is checking in on them, places them at greater risk. So looking at factors that contribute to overdose in more detail and strategies to prevent that risk. Avoid mixing your substance if you can. So there are ways you could do that. So if you are using drugs through injection, you can use different syringes. You can color your syringes with a marker. You could use different cookers or spoons for different substances. Most overdose deaths happen when multiple drugs have been involved. So to prevent the risk, use one drug at a time or use less of each drug if you are mixing. Regarding tolerance, the body's ability to increasingly withstand the effects of the drug that's being used, it does develop and change over time, and it will depend on your weight, your size, your stress, your immune system, and age, and all those other health factors that we talked about before. So to prevent risk, use less drugs when you know that your tolerance is lower. So if you know you are exiting hospital, treatment, or jail, or you know you've been tapering your methadone, just be mindful of that. That could put you at risk of overdose. Regarding drug quality and potency, trying a very small amount first. So if it is a new drug or a drug that's not familiar to you, trying a small amount first to see how it affects you. This goes for alcohol as well. So let's say, for example, you have like an imported bottle where you can't read the label, or it's a new alcohol to you and you're not sure what the proofing is of the alcohol, like trying a small amount first, waiting to see how it impacts you before you consume any more. Using alone, obviously, if you overdose, no one will be there to help you. So to manage some of the risk, using with a friend, obviously not sharing gear. Maybe a family member can check on you or the friend could check on you. Call somebody before so they know that you are in a period of using and they can check on you. You might see posters like this. This is a Southwestern public health alert. Look for these alerts on social media and the websites for Southwestern Public Health, as well as our website. These alerts are released to the public when there are new overdose trends. Recent trends include powdered fentanyl. The reason why these alerts are important is because they can change often, and they give us a lot of detail, kind of like on the ground news, I guess, in drug trend changes. So if, for example, there's been a lot of overdoses in one city because there's like mixed substances or a change in the supply, it might say like alert powdered fentanyl, purple or green, whatever color it is. Like people are known to overdose in greater frequency and also have found like cocaine or crystal meth contamination. The reason why these alerts are really important for people who use powdered fentanyl is because it's really hard to tell just looking at the substance. But if you know that there are alerts in, say, London, and you live in London or one of the counties, you might be more mindful of how you're using a substance. So regarding the coronavirus and opioid use, coronavirus is a virus that does cause a respiratory infection and other health problems. So because fentanyl and other opioids can slow your breathing rate, remember that COVID-19 may also increase the risk of overdose death when you are using opioids. So in this next section, we're going to talk about how to recognize an overdose from depressants. So that includes things like alcohol. Alcohol overdose would be like extreme intoxication, which can take your life. It's often the result of a person passing out, vomiting and choking and aspirating on their vomit. A person who's been drinking heavily and is unconscious should be laid on their side and watched closely. Alcohol poisoning occurs when there's so much alcohol in the bloodstream that areas of the brain that control basic life support functions like breathing, heart rate, and temperature control begin to shut down. Symptoms of alcohol poisoning include confusion, difficulty remaining conscious, vomiting, seizures, trouble breathing, a slow heart rate, clammy skin, a dulled response to stimuli, so like their name or like the shake and shout kind of method. If they have no gag reflex, which would prevent choking, so vomiting that's just sort of coming out, and extremely low body temperature, which can also be fatal. So with binge drinking and withdrawal from alcohol, those are also risk factors for seizures. With alcohol poisoning, it's important to remember not to wait for all of these symptoms to show up. If you suspect that a person is experiencing alcohol poisoning, you don't have to wait. You can call 911. Other depressants would include things like GHB. At a higher dose, this can cause nausea and vomiting, can make a person fall into sort of a deep sleep, which might appear harmless on the surface, but if a person's not breathing and not being checked on, they could be at risk of death. And opioids, which are another depressant drug. So that means they slow down the part of the brain that controls our breathing. All opioid drugs are dangerous in large quantities or when they're taken with other depressants. So that could include alcohol or benzodiazepines, which are like anti-anxiety medications more commonly. Signs of overdose include slow breathing, bluish skin, or coma. Death can happen, usually because their breathing has stopped. But if a person is caught in time, if an overdose is caught in time, you can reverse it with naloxone, which we're going to talk about later in the presentation. It blocks the effects of opioids, including some of those effects on breathing. People who use opioids regularly can develop a tolerance, which means they need to use more and more of a drug to achieve a desired effect. And as the amount taken increases, so does the risk of overdose. People with a high tolerance, when they stop taking a drug, they do lose tolerance over time. And then when they resume taking the same amount they took before they stopped, the risk of overdose is higher. So usually with opioid overdose, from my experience, one of the classic symptoms is, of course, unresponsiveness. So that when they're not able to respond when you call their name, or like if you shake their shoulders. You'll also see if they do have an overdose, they'll be a little bit blue in their lips here, pale, almost like spending too much time in the lake or in a swimming pool, when your lip turns a little bit blue. And of course, they're not going to be moving. Their body will be limp. Sometimes people will make snoring or gurgling sounds as well. Sometimes people will vomit. Another important thing to consider, if you are a person who uses opioids, you are at a greater risk of seizure if you have an underlying seizure disorder. So sometimes people will have a seizure after using opioids, which seems almost counterintuitive, but it's because the opioid use has changed the seizure threshold. So it's more likely to bring out a seizure if you are unmedicated for seizure disorder. How to recognize an overdose from hallucinogens. So primarily what you're going to see is psychosis. And at high doses, blood pressure, pulse rate, and respiration can drop, usually accompanied by nausea, vomiting, blurred vision, flicking up and down of the eyes, like inability to focus, drooling, loss of balance, and dizziness. Under the category of hallucinogens, cannabis can be included. No one has ever died of a cannabis overdose, but there are, some dangers that can cause death in other ways. So for example, because cannabis impairs depth perception, attention span, and concentration, and it slows our reaction time, it can really impact a person's ability to drive safely or walk safely. Cannabis and alcohol, when taken together, can really intensify effects of each other. And large doses of potent cannabis or salvia, especially when ingested, can cause toxic psychosis. So symptoms would include hallucinations, delusions, confusion. Um, you might also see with hallucinogen overdose, like difficulty controlling your body movements and things like that. Sometimes people will be in a trance-like state, so a state of mind in which their consciousness is fragile and voluntary action is poor or missing. So with other hallucinogens, really important to remember there is still a risk of death, like especially, or damage to the brain, especially in really, really large doses. So you might think you don't need to call 911, but if a person is having some of these symptoms here, like seizures, coma, like they're not able to wake up, important to remember, still call 911. That is still an overdose. How to recognize an overdose from stimulants. Stimulant overdose, this will be like the opposite of an overdose from a depressant. So stimulants would include things like cocaine, crystal meth. Because cocaine causes the blood vessels to thicken and constrict, which reduces the flow of oxygen to the heart. Cocaine does put people at risk of overdose death, causes the heart muscles to have to work harder to pump your blood, which can lead to a heart attack or stroke, even in healthy people. Cocaine does raise blood pressure, which can cause weakened blood vessels in the brain to burst. A person can overdose on a small amount of cocaine, and there's no antidote to cocaine overdose or stimulant overdose. When cocaine's used with alcohol, the liver produces something called cocaethylene, which is a powerful compound that increases the risk of sudden death beyond the risk of just using the cocaine alone. Crystal meth causes the heart to beat faster and blood pressure to rise. Since what is sold as crystal meth will vary largely in its potency and content, it's really hard to tell how much you are taking at one time. Crystal meth overdose can result in a seizure, high body temperature, irregular heartbeat, heart attack, stroke, and death. And of course, the risk of overdose is highest when a drug is injected. For MDMA and ecstasy, although some people regard ecstasy as a relatively safe drug, there are a growing number of deaths associated with it. As with many illegal drugs, these risks will increase with the amount taken and the frequency of a person's use. A major factor in many of the ecstasy-related deaths is dehydration and overheating that can result when ecstasy is taken in conjunction with all-night dancing or partying. Ecstasy increases our body temperature, our blood pressure, and our heart rate. It can lead to kidney failure or heart failure, strokes, and seizures. It can also cause damage to the liver over time as well. People with high blood pressure, heart or liver problems, diabetes, epilepsy, or any similar conditions do make them vulnerable to overdose from stimulants. And this can be a pretty quick onset as well. So usually what you will see with stimulant overdose is the classic symptoms of racing heart, elevated blood pressure, profuse sweating. People will complain of tightness in their chest or maybe even pain in their chest. Seizures, difficulty breathing, shaking, vomiting, and commonly headache, dizziness, or fullness in the head, ringing in the ears, sudden collapse, and loss of consciousness. So looking at the route of administration, which we've mentioned a couple times, you can minimize your risk of overdose by changing the way you administer your drug. The route of administration will determine the quickness and intensity of the drug's effects. The faster the drug hits your bloodstream, the greater your risk of overdose. However, changing your route of administration will also require changing the amount, at least initially, until your tolerance has built up. So firstly, we recommend using one drug at a time. Try to avoid mixing your substances, of course, because some of those dangerous combinations can have health effects that we talked about earlier. Alcohol is a very underestimated risk factor, and remember that it will affect the way that you metabolize other substances, including things like crystal meth or MDMA or cannabis. If you are able to, use standardized measuring methods. So if you are using alcohol, try to use the same glass or the same type of glass every time. If you are able to measure, that would also be helpful too. Then you can start to understand how much your body is able to tolerate at one time very concretely. And of course, wait before you take another dose. So that would include alcohol, it would include opioids and crystal meth. Practice caution when you are substituting or transitioning between substances. Test your drugs if you are able to. So I can give you some examples of how to do that. If you are using injection drugs, you can go to the CarePoint or Overdose Prevention site, and they can do a fentanyl test with you on site. It's a confidential anonymous service, so if you are worried that crystal meth you've purchased has, for example, fentanyl in it, you can go there. They can do sort of like a little screening test where they take a very, very small amount in a cup, and they have a dip test that tells them if it's positive for fentanyl. Not every test is perfect, and there are many, many analogs of fentanyl, but that's one example of how you could get your substance tested. Purchasing from a reliable source. So one way to go about that might be, for example, if a person is using cocaine and their doctor has told them, you know, you have some like levamisole poisoning, you can do regular urine testing to see, you know, if there is levamisole or other cross-contaminations in your drug just based on like p-test or a blood test. Learning from other users and service providers on what the current trends are is another way to minimize your risk of overdose, so you know what's going on in your community and with the drug supply. Not using alone or in a place where people cannot help you. So to minimize your risk, try not to use alone, or if you must use alone, let other people know what's going on for you so that someone can check in on you. Talk to an experienced person or a healthcare professional about reducing your risk, and create an overdose safety plan. Learning overdose response training and carrying naloxone might be part of creating an overdose safety plan, and we're going to talk a little bit more about that. So responding to a stimulant overdose, stimulant toxicity looks like rigid or jerking limbs. They'll be in and out of consciousness, probably having a seizure, or complaining of like the tightness in the chest that we talked about, sweating, really, really uncomfortable. Medical attention is required immediately. Encourage liquids, unless of course they are unconscious. Do not pour liquids into someone's mouth if they are unconscious. If a person is having a seizure, one of the treatment myths of seizures is that you have to do something to intervene. You don't have to. It's actually recommended that you clear the area of anything that could harm the person. So make sure that they can't hit their head on something. If they are falling to the ground, like help them lower to the ground and clear a space. If their heart has stopped and they're like completely unresponsive, you can do chest compressions. You don't have to give rescue breaths. Stay with the person if you can, and give any important information to EMS on the phone. There is no antidote to stimulant overdose, so that 911 call is really important. Regarding stimulant overdose, so like we said, stay with the person, give them water, place a cool wet cloth on those heat zones, so armpits, back of their neck, or on their head, like their forehead. Open a window for fresh air, and move the person away from busy activity. If during the stimulant overdose, a person is experiencing a lot of paranoia, aggression, or anger, clear a space, like create space, remove an audience if there are other people. And if you are uncomfortable or unsafe, even if that person is having an overdose, you should leave. You can call 911 from a distance. So regarding opioid overdose, this little printout here you'll find in Naloxone kits. So this is like the opioid overdose response plan. I like to call this like the, oh God, what do I do plan? So steps 1 through 5. So if you are responding to an opioid overdose and you are taking out your Naloxone kit, you will find this, oh God, what do I do plan inside your kit. Step 1, shake and shout. Shake them by the shoulders and call their name. If they are not responsive, that's when you call 911, because those extra minutes that you get are very, very precious and important. So if the person has those classic opioid symptoms that we talked about, like the blue lip, they're not responding, they're very pale, they're very cold, you can give naloxone. Naloxone is a nasal spray, or it also comes in an injectable form, which is a little bit harder to find in Ontario. But you can give naloxone, and it will not hurt the person if they are having an overdose from something else. It's better to give naloxone and try to save the person, even if you're not quite sure what substance they've overdosed from. There's a common question that comes up when I do this presentation about allergy to naloxone. If a person does have an allergy to naloxone, it's not really well documented in the literature about what that looks like or how common that is. But thinking about it, in the context of an emergency, it would be better to give the naloxone and save the person's life and have them take like a Benadryl later than it would be for you to withhold the naloxone and that person to die, if that makes sense. Right, so shake and shout, call 911, give the naloxone, and check if it's working. It may work immediately, but we've noticed with the fentanyl overdoses in London, Ontario, more than one dose of naloxone is required. So after you've given naloxone, you can do the chest compressions. If you are comfortable and trained in CPR, you can give the rescue breaths. But most importantly is the chest compressions. Then check if it's working. If there's no improvement after 2 to 3 minutes, repeat the steps over again. Give the naloxone and give the chest compressions again. And stay with the person if you're able to. So I mentioned a take-home naloxone kit. So you can get these kits from like pharmacies, some doctors' offices. You can also get them from our office when it is reopened. So for now, I would recommend to go to Regional HIV/AIDS Pharmacy and the Health Unit if you need a new naloxone kit. So inside your kit, you're going to find non-latex gloves, the training certification card, which is just like that little cardboard piece you see, 2 Narcan nasal sprays, so that's 2 doses, and 1 rescue breathing barrier, which is found in most kits, and the 5-step fold out, or the "oh God, what do I do" plan. So with the COVID-19 crisis, you may not want to be giving rescue breaths, and when you are giving naloxone, you may want to have something to protect you, like when you're addressing the emergency. So you might want to put on those gloves if it's a person that you don't know, or if it's a person who you know has been exposed to COVID-19. So what is naloxone? Temporarily blocks the effects of opioids. It's also called Narcan. This is a medication that will reverse the effects of opioids, usually for 30 to 90 minutes. It's only temporary. It is very fast acting. Sometimes more than 1 dose will be required. It does save lives. Naloxone has been popularized in Ontario, in Canada, and the United States because it is so effective at saving lives during an opioid overdose. So when the naloxone starts working, if the person is in fact having an opioid overdose, it might induce withdrawal in opioid users. So withdrawal, usually the best way to describe it is it's like the opposite effect of what the use looks like. So if when I'm using opioids, I feel like relaxed, I feel calm, and maybe not moving a whole lot, it's going to kind of do the opposite. So I'm going to feel not relaxed, not calm. I'm probably going to feel like I'm going to throw up. It's going to have like that opposite effect. So if it does induce withdrawal, sometimes people do feel pretty guilty about having administered the naloxone, but remember, nausea is temporary, whereas death is not. So it's better to give the naloxone. You should still call 911 if you've administered naloxone. Ideally, call 911 whenever you encounter an unresponsive person. But if you are in a situation where maybe you and other people are using, you can call 911 to have EMS come respond and assess the person because the naloxone is only temporary. If the person returns from their overdose and they're wanting to use again because they're in withdrawal, encourage them to wait, hopefully 2 hours, because they could still go into overdose. They might still be on the cusp of overdose, and using again will just put them right back into overdose. Naloxone can only be effectively used in opioid-related overdose. It does not work with other substances, but it will also not cause harm. Responding to overdose in the community, shake and shout. If the person is not responding and not able to take breaths, call 911. If a person is in and out of responsiveness, you can do what some EMS workers do, which is like a sternum rub with your knuckles. So you take your knuckles and rub in the middle here of the chest and encourage the person to take a breath. If you are wanting to respond to an overdose in community, anybody who's not helping should leave, so as not to interfere in the process of like saving this person's life, right? So in basic emergency response, you only need essential people there with you. So who is responding to the overdose and who is calling 911? If you are alone, you might be both of those people. So put on the gloves, use the face shield or breathing barrier if you are giving rescue breaths. The face shield has a one-way valve and a large impermeable area which will protect you from respiratory secretions, but we don't know about the effectiveness of that during the COVID-19 crisis, so it would be up, like your discretion if you want to give the rescue breaths or not. After you have responded to an overdose, dispose of all of your materials, including the gloves and the face shield, and wash your hands thoroughly. If you are giving chest compressions, you can place a towel or a piece of clothing over the person's nose and mouth to protect you from droplets if the person is like coughing when they come back. So support the person in the recovery position and wait for EMS to arrive. So recovery position means they are on their side, usually with one arm under their head. The reason why recovery position is important is because if the person is to vomit, they're going to vomit sideways and they're not going to choke on it. It is still okay to call EMS during the COVID-19 crisis. So here's like demonstration of how to do the recovery position. So their head should always be tilted back to open up the airway, and their knee, if you're able to pull it out, it'll stop them from rolling onto their stomach and occluding their mouth and nose so that they can breathe. If the person's unconscious and breathing, keep them in that recovery position and wait for EMS to arrive, and you don't need to leave the person alone. There is something called the Good Samaritan Act in Ontario that will protect you if you have substances on you. So it will protect you from simple possession if you have substances on you and you're responding to an overdose and calling 911. There might be some restrictions to the Good Samaritan Act if a person is, say, on probation or parole and has like non-association orders. So consider that as well. But for the most part, in just generally speaking, responding to an overdose, if you have drugs on you, you are protected because the government and the police want you to call 911 when you're responding to an overdose. So these are some places you can get a naloxone kit. So like we said, various pharmacies, the health unit, Intercommunity Health Center, Regional HIV/AIDS Connection, and you can do so by appointment by calling 519-434-1601. In the counties, you can get naloxone at the Oxford County Public Health Needle Exchange. That's at 410 Buller Street in Woodstock. Calling 519-539-9800, extension 3427. In Aylmer, you can go to the Hills or No Frills Pharmacy. In Strathroy, the Middlesex London Health Unit, 51 Front Street. And in St. Thomas, you can go to Shoppers Drug Mart or Pharmacy. So here's what I was talking about, the Good Samaritan Act. So it applies to anyone seeking emergency support during an overdose, including the person experiencing the overdose. So there's some legal protection for people on parole, pre-trial release, probation orders, and simple possession or conditional sentences. but it will not provide legal protection against more serious offenses, like if you have an outstanding warrant, production and trafficking of controlled substance charges, or other crimes not outlined within this act. You can learn more at canada.ca/opioids. If you are quarantined or in isolation, ask a friend to pick up supplies, including a Naloxone Kit from harm reduction sites like CarePoint, run through RHAC in London. Try to have the substances that you need to stay well. Know that carrying large amounts may put you at risk by the police and other people looking to score. Consider alternatives to your drug of choice, and prepare for potential supply disruptions during the COVID-19 crisis. You may go through involuntary withdrawal if your supplier gets sick. Have a backup plan and be cautious if you are using a new supply. Also, try to have the medications that you need. Refills might be available directly through your pharmacist or by telephone without having to see a physician, because there's been some changes to how pharmacies operate because of the COVID-19 crisis. So if you're feeling unwell and you require medication, call your pharmacy in advance. Health Canada is working on exemptions to ensure access to addiction medicine, such as naltrexone, methadone, and Suboxone, for example, through our RAM clinic at 648 Huron Street. So as we conclude our presentation, here's some final thoughts. It's important during this difficult time of the COVID-19 pandemic to stay connected as we distance ourselves further apart. If you or someone you know has experienced an overdose, talk to your counselor to debrief the event and get support. Here's a quote from Brené Brown, who's a famous author in social work and trauma. She says, "Connection is the energy that is created between people when they feel seen, heard, and valued, when they can give and receive without judgment." So thank you for tuning in to our presentation. If you have questions, please feel free to reach us at the numbers that we listed at the beginning of this presentation. Hope you are all staying safe and healthy, and remember that harm reduction is a form of treatment, and this might be a person's first step into accessing addiction treatment and beginning their recovery. So thank you all so much, and take care.